You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from benchside to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast.
Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, and today we are joined by ONS member Jane Greene, massage therapy coordinator at Memorial Sloan Kettering Cancer Center in New York, New York, and a member of the ONS New York City chapter to discuss how complementary therapy with body techniques such as massage, therapeutic touch, and Reiki are used in integrative cancer. Thank you for joining me today, Jane.
Thank you very much, Stephanie.
First off, can you give us a brief history of body techniques and how they've been used in healthcare?
Well, we've come a long way. Massage is an ancient modality, and back in history, how certain techniques were practiced in Egyptian times with reflexology. We see that something such as Reiki was practiced many years ago, coming from the Japanese tradition. And now, with high need for this type of modality in cancer care, consumer interest, and just really more specialized training for massage therapists, the merging of all of this has kind of come together and allowed massage to be applied in various health settings. So it could be anything from a rehab center to a hospital to a hospice, to many other types of settings. And massage is a wonderful modality, and it's oftentimes looked at as the gateway to other complementary therapies because it is so familiar to many folks and very user-friendly, and because it can be so easily employed. It's a wonderful modality that has a lot of benefits and can easily be implemented. So we see that more and more healthcare providers in cancer care and integrative therapies are referring patients to practitioners that can provide this type of therapy because they recognize the benefits. And there is more and more information coming out, reliable information, that this is in fact a safe and effective and really sought after modality by patients who greatly benefit in symptom management, improving their quality of life, and improving their self-awareness, which can be very helpful and empowering to patients who can then direct more of their care when they recognize how they're feeling and what they respond to most. So at Sloan Kettering, we have an integrative medicine program that's been in operation for 20 years, and it has grown tremendously. There is a great acceptance of massage as being very beneficial. So not only do we see, massage employed in these many different settings, but we also do a lot of education so that patients and their families, loved ones, partners can bring this home with them and actually utilize this technique when they need it most, when they're at home or going through the side effects of their treatment or the progression of their disease, or have a lot of anxiety just about the trajectory, the course of their illness and their treatment.
Thank you for that overview. You talked about symptoms and side effects of treatment. So can you talk a little bit about what cancer symptoms and treatment side effects can body techniques mitigate?
Sure. And this is something that we often educate nurses about and patients and the caregivers, because people have a general sense of what perhaps a massage might be, and they either include themselves or exclude themselves to thinking that they can receive it or not receive it because of what they're going through. So in general, massage can be applied for most, like any patient, I would say, with certain guidelines. And oftentimes nurses will refer to us for symptoms of the top 5 I call: pain, anxiety, depression, fatigue, and nausea. So we have different techniques to address different symptoms. There is the usual technique where you use Swedish massage, which is gliding, flowing strokes on the skin, manipulating the tissue, the muscle, the fascia, and that can be very beneficial. But then there are more specific techniques, neuromuscular techniques, manual lymph drainage, scar tissue work, myofascial release, trigger point therapy, which then more specifically addresses musculoskeletal issues, perhaps some other symptoms like nausea or constipation. The fatigue can be addressed as well because a lot of times patients are not moving as much, and massage promotes circulation and can be a flowing type of modality which stimulates and energizes. But at the same time, it helps the body relieve tension so it can relax and reset the nervous system to feel better able to manage whatever it is that they have to deal with that particular day. Massage can be very helpful for specific areas that are experiencing difficulty, for instance, post-surgery, post-mastectomy, or if they've had lung resection and things have been cut and changed, and the healing of the tissue is distorted, perhaps, and the way the patient moves, their range of motion is altered. So using massage can facilitate promoting range of motion, promoting circulation to help with healing. We are a highly specialized modality nowadays, but we have to also recognize the basic benefit of massage is to help with relaxation. And there's tremendous benefit in relaxation. It can help the patient in their relationship to their symptoms. So when I say we can help specific symptoms, by relaxing the patient, we can actually help overall their relationship to their symptoms. To give you an example, I had a patient recently, inpatient, who was experiencing a lot of abdominal pain from a tumor that was compressing her circulation and all of her organs. And I was not going to change that. However, with the use of certain touch techniques, I was able to get her to a more relaxed state, into a more comfortable state, that she could rest better and felt an improvement. So we have specific local musculoskeletal issues we can assist with. We have the emotional distress, existential distress that patients have, that the comfort the massage can bring them and the family, the caregiver, is tremendous. So that touch, when they've had so many alterations in who they know themselves to be, having that comforting touch can help them integrate better their experience, help with their suffering that they're experiencing. Oftentimes when we see a patient, they have all of these symptoms, multiple symptoms, at the same time, or maybe today they have more pain, tomorrow they have more fatigue, the next day they have more constipation, and then the next day they have frustration because they can't be discharged because they haven't gone to the bathroom or reach some other milestone that they need to reach. So there's this whole evolution of their symptoms and changeability of their symptoms. So we just try to adjust to whatever that is that they're experiencing in that moment, try to teach them some techniques that they can use or a family member can help them with when we're not there, and try to incorporate perhaps other modalities that could assist as an adjunct with massage or instead of massage, or perhaps patient preference. They may want to add something or prefer one modality over the other. So we do a lot of education about the different options that they have within massage, but also other integrative therapies. And we try to offer different techniques because patients have different needs. We tailor the treatment to whatever the patient needs in that moment. We deal with a lot of different symptoms, and that's one thing that oncology massage therapists are very adept at doing, is trying to create treatment plans that adapt along with the patients wherever they are, whatever they're experiencing in that moment in time. Because that's one thing that in oncology, patients do experience a multitude of symptoms. They're very changeable, and they could be mild or they could be quite severe. Sometimes a patient may have a symptom. They may have a blood clot in their leg and they have a lot of pain in their leg because of it, but I can't massage that leg because of the DVT in that limb. Being able to adjust and do something that would feel good and as well as effective to help minimize that pain or that preoccupation with that symptom is something that I would want to focus on. A lot of times when we treat patients, we do effectively decrease their symptoms, but even if we don't, oftentimes the secondary and the other symptoms that they were less aware of improve. There are practitioners who are skilled or trained that have joined other organizations that are skilled in this type of approach. And there are a lot of qualified therapists out there who could help these nurses help their patients with feeling better, improving, not only feeling better, but as one patient told me yesterday, getting better. So it's really something that is a very powerful modality to be utilized.
Great. So, what kinds of questions do patients have about using body techniques? Or do you see them seeking out these treatments on their own? Or is this something that is introduced to most patients as something new?
There's really a mix. At this point in time, we have very savvy patients. We have people that request the service and they're familiar with it. They have massage on the outside when they're not in the hospital, when they're not in treatment, and they want this type of care. They seek it out, and it's something that where we are at, sometimes we don't have enough appointments for patients as frequently as they would like. However, there are patients who've never been exposed to massage before, or have never considered it for themselves. They thought that they would be excluded from receiving it. And many years ago, the myth of not being able to massage cancer patients sometimes, resurfaces. And you'll see a patient who'll say, well, I was told I couldn't have this, and we have to educate them that massage for most patients is something that you can utilize. It's just a question of where they receive the massage, the duration of the treatment, the pressure that you use, the area of the body that you work on, their preference, their availability, their budget, their interests. Oftentimes they're juggling multiple competing priorities, and they may not be able to have a massage because they just don't have the time or their money, or they don't have the energy or someone to drive them to another appointment. They have someone that's taking them to their oncologist, to their chemotherapy appointments, and they don't feel it rises to the importance of those appointments to ask someone to take them for a massage. There's all sorts of barriers to getting a massage, but there are a lot of people who definitely seek it out. They tell us what they want, and we do our best to try to accommodate. And if it's not something that we can provide because of their medical history, it's contraindicated, we try to find another option for them within massage to help them. So oftentimes patients are used to a very deep massage when they go to an outside therapist. But if they're in the hospital, or if they're even getting chemotherapy and their platelets are extremely low, we wouldn't be providing a deep massage in the same way. We can provide massage that may affect deeper structures, but in a way that is accepted, assimilated by the body, and doesn't cause any bruising or injury to the tissue, the bones. And we try to have them experience this new way of experiencing massage to see how it works for them. I've had, truthfully, some handful of patients over the years that absolutely don't want anything other than what they're used to. But most patients are willing to try different ways we deliver massage, because we explain that today we can't, let's say, massage this leg because you have a blood clot, but we can massage the other leg. We can massage your back. Or if some other issue with one part of your body, you've had surgery and mastectomy, and you don't want anything done to your upper body because you haven't quite assimilated everything and the changes to your body and all that, we may do something like foot reflexology, which can be very relaxing and allow the patient to really feel more expansive, to feel much safer, to have touch very distant from where their body was manipulated and where they had surgery. So they can lay back, they can have a foot massage. And the theory behind reflexology is that there are certain parts of your feet that pertain to other areas of the body. And as we know, there are many, many nerves in the foot. So simply doing a foot massage or reflexology, you can help benefit the whole body. Patients have questions about, how would this work? I'm in the hospital. I haven't showered. I'm going for a CAT scan soon. I have diarrhea. I have a lot of pain. My husband's in the hospital too. I have 5 kids at home and I'm in the hospital. They have a lot of different things in their mind. You may look at them in their room and you think, well, they're just sleeping, but they're really not. They're there mulling over all of their other issues. And so we try to work out a way that they can get treatment, find out when they're available, if they're in the hospital, if they're in the chemo suite, outpatient. We try to find out what day their chemo treatment is and try to meet them on that day to have some kind of continuity. If they're outpatient, they can come to our outpatient center. We try to have the same therapist see them and follow up as often as possible. We try to find ways to deliver this service, and we try to make recommendations as well if we see that some other modality, or within massage would be more effective. Like neuropathy is a big symptom that our patients have, and they say, well, I have neuropathy in my feet. I don't think I can be treated there. But there is really a lot of different qualities to neuropathy: pain, numbness, temperature changes, stiffness, gait issues, balance issues. So we try to find out, well, what is it? Is that you cannot be touched, or is it just a certain type of touch, or is it a certain part of your foot that cannot be touched? And we work with that. And I would say 9 times out of 10, we can always do a treatment to the feet that have neuropathy in a comfortable way. So really getting to the root of what it is that's bothering them, or if they're unsure and they just have a general sense of feeling unwell or anxious, we'll start with something relaxing and introduce it to them and ask them just to, experience it for 5 or 10 minutes and see how they're feeling. And oftentimes they'll just say continue. We also try to frame it that, in the hospital, our visits are 20 minutes, so they're not an hour. And that also helps too, because the visits are short. We know that they're effective and they're short. And that can oftentimes work with a lot of other commitments patients have in the hospital, between other teams seeing them, tests that they're having, family visiting. Not so much now in COVID times because the visitation is severely limited, but it helps in terms of fitting this in a way that works all around. And in terms of COVID, patients say, well, because of COVID, can I have massage? And we do basically observe COVID guidelines. We distance ourselves. We're wearing masks. We're wearing PPE. Patients are wearing masks during their treatments with us. And we're doing screening before they're treated. In the hospital, we're seeing COVID negative patients that are tested COVID negative. And then outpatients are interviewed. And if they have no sick contacts and negative themselves, no symptoms, they'll be treated. So again, we've worked around that as well and try to find a pathway so that they can still receive treatment. We also have many patients that don't live near our institution, so we help them find qualified therapists in their area. So that's a big question. I really enjoyed this treatment, but I live in a rural town. We try to provide resources for them online, names of organizations that have qualified members, so that they can reach out to them to find someone locally so that they can continue with the massage therapy. And if there's a caregiver at the bedside, we educate the caregivers how to deliver basic touch therapy techniques. And that can be very helpful because that's a question patients have. They have limited resources and limited access to other practitioners. So we try to give them the tools that would help them while they're at home.
Thank you. You've really given us a lot of information about how the cancer team can incorporate using this integrative care into patients' treatment plan and how we can, really use this to work with patients on symptom management and asking them about what works best for them. And then also, just the assessment of things. Can you walk us through an average session that you would have with a patient?
Sure. And I'd like to highlight 3 different types of sessions. The first is an inpatient session because I realize the membership, they have a lot of different settings that they're working in. And inpatient, in our system, we get referrals from nurses, doctors, social workers, chaplains, everybody, PTs that are part of the interdisciplinary team. And they provide us with some symptoms in the patient's diagnosis. And we usually go to the patient's room. During COVID times, we may do an outreach by phone, but that can be difficult because oftentimes patients are not answering their phones. So we do work with the nurses on the floor to assess, is the patient available? What are their symptoms? Do they want massage? And when we do go into the room with the patient, we introduce ourselves because many times patients see many practitioners. They don't really know our role. So we have to be very clear. And because massage can overlap in so many other disciplines, because we do listen a lot to the patient's concerns, we are therapists and we're part of the team and we're available oftentimes for 20 minutes, and that's a long time in hospital time. So patients can really share quite a bit. So they may feel very open, very comfortable with us to share their feelings, their concerns. So we have to be very clear about our role. So we do stress that we're part of integrative medicine and that we're massage therapists. And what we'd like to do is help them with their symptoms. And we ask them if they're having symptoms because oftentimes they're referred for pain. But when we get there, their pain has been managed with an IV, with a PCA, and other interventions. So they may not have pain at the time of visit, but they may have a side effect, like I said, maybe constipation from the pain meds, or maybe another symptom has really become more prominent. We try to assess what their symptoms are, usually on using a 0 to 10 scale. And if patients have difficulty with the numerical system, we may ask them, well, is this the worst pain you've had, or is it better than the worst pain? Try to get some gauge as to where they are at the start of the treatment with their pain. And we give them options. So if they have back pain and they're able to move on their side and work with them, or if they can't lay on their side, I may have to do some other intervention when they're on their back. So I'm not working directly to the area that's bothering them, but indirectly. I give them options. I set up the room in a way that allows me to get access as best possible, because you want the therapist to be comfortable and the patient, and have it be safe, and have the nurse be able to access whatever she needs while we're doing the intervention, because people come in and out of the room during a treatment. So we work with the patient. We ask them how they're feeling during the treatment. So if we need to adjust anything, we will do that. If they need to change position or go to the bathroom, or maybe they've had enough that after 10 minutes, they decide, I'm comfortable now, I don't need any more. Or, they have some other concern and they want to stop the treatment. So being able to check in with them and adjust, and then do a post-treatment evaluation to see where their pain is. And oftentimes, we know from responses that we collected, at one time from 1,200 patients, we know in 20 minutes, symptoms go down by 50%. The thing is, the top 5 symptoms usually go down significantly. And even if they don't, generally, like I had shared earlier, that the patient usually experiences some sense of relief. And then we do document this. So before and after, we're checking their patient history, checking in with the nurse, getting the history from the patient, doing a pre and post assessment, finding how we can create this continuity, and also engaging them, to continue, with our programs and other programs that we know to be beneficial. In the chemo suite, we do connect with the nurses very, very quickly, patients that are interested in massage when they kind of get into their area. And there's a list of patients that are given to the massage therapist that are interested, and they will go over, introduce similarly the same way inpatient, and try to work with them. If it's not a good time, if a patient's feeling very nauseous, they have other issues going on, or they're busy with the nurse with other things, we may just do education and we may follow up with them. But oftentimes we'll do a lot of head and neck and back massage in the chemo area, and a lot of foot reflexology. In the hospital, we do a tremendous amount of reflexology. Outpatient, again, patient history, looking up their records, obviously checking for any blood clots, PEs, DVTs, mental status changes, looking for where they have involvement of their cancer, whether it's the bones, the soft tissue, the brain, other areas, thinking about their positioning, how much time can they tolerate on their stomach, on their back, talking with them, looking at how they walk, observing them, making recommendations. We have 60 minutes in the outpatient suite, so we have more time to work with them. If their issue is lymphedema, we may do 30 minutes of manual lymph drainage, but then we may do 30 minutes of another technique. If someone comes in and has persistent nausea, they have leukemia, they're very fatigued, and they don't really particularly benefit by having their feet massaged, they may like something like Reiki, which is, in our practice, we do hands-on Reiki. So it's very light touch, but it's steady. It's light. It's more of a holding in certain parts of the body, which can be very comforting and settling for someone who has a lot of nausea, has a lot of anxiety, who has difficulty relaxing and resting. This allows them to do that. So, outpatients, they generally follow up on an ongoing basis. Inpatient, we may never see a patient but once. They'll be discharged and they may not be readmitted, or they may not come back to MSK for their treatment. We deal with a lot of patients with complications from their surgeries. We have a lot of patients that come in with progression of disease and end of life. So those treatments are tailored to what would make sense. Someone with altered mental status changes, we have to be careful with the use of touch, because they may not necessarily recognize our intention or the benefit. We get a lot of calls for the ICU to provide treatment there. And in that setting, we may provide foot massage, a lot of Reiki, and mostly to our patients that maybe are lightly sedated or awake. Not so much the heavily sedated patients that don't have the ability to engage and articulate how they're feeling. We do provide other modalities for those patients, music therapy and other modalities. But, we do follow up, because we know they may want us to come back when the patient is being extubated and they want to wake them up and they want the stimulation. So they want massage therapists to be on hand. So there's a lot of different things that we do, different areas. The treatments inpatient are 20 minutes, same for the chemo suite. And then the outpatient is generally about 60 minutes. And there are times inpatient we only may be able to do a 10-minute treatment before the patient gets called to go to a test. We try to make it as holistic, as impactful as possible in a short amount of time. When we leave that room, we've given them another tool in their toolbox to help them make getting through the treatment, their recovery easier. I think that patients trust nurses, and nurses spend most of the time with their patients. And we spend a lot of time in servicing nurses. So, finding a resource and trying to provide in services to your team of nurses is really important to try to keep your education going, to learn more about how it can help is really key. And there are many more therapists out there now than there were 20 years ago that are trained, committed, and skilled at oncology massage. So they're out there, and you can definitely tap into their expertise.
Thank you. You've really given us a lot of great information and good information for nurses to know about the different ways that this can be done in the different treatment settings. So, what would be something about body techniques that's not often discussed, but you wish people knew more about?
The first thing is to consider massage. Massage is a viable modality and it has a lot of benefits. Massage can be helpful for that scar tissue and helping improve range of motion and elasticity to the skin. I think that once patients get through the treatment, as long as they fared okay getting through the treatment, they don't always recommend massage or other modalities. And many patients have told me that when they sort of end the treatment, that's sort of when they kind of begin again. And what do they do with the side effects of the treatment? And patients need to know that there are options for them. If they never quite regained to move in a certain way, they've lost function, that massage can help them regain function, help them feel more like themselves. It's not something that they have to just live with. Of course, there are always things that if they've had a surgery and there's a scar, things that will always be there. But in terms of how it affects their activities of daily living, how they perceive themselves, there are things that we can do to help, and as I said, there are different ways to, it could be just the fact that they have to go to a scan every 3 months and the anxiety builds. Having a massage around that time could maybe be very helpful. And going to someone who is skilled and experienced is really key, and comfortable, making sure that the therapist is comfortable massaging you, because many therapists may know that you can work with cancer patients, but they don't have the training or just don't feel comfortable doing it. But finding someone who is really experienced, that's really key. I think that would be very helpful for patients to know that there are a lot of people out there that could be tapped into, and to provide, access to, for instance, like the American Massage Therapy Association or the Society for Oncology Massage Therapists. That's those two things are very helpful resources to find massage therapists and talk to someone and get a sense of if you would feel comfortable working with them and what they, you can look at their experience of where they've worked and find out if that's sort of in line with what you feel comfortable. Just knowing that, physical therapy is not the only thing that someone can do. If they have lost some function, massage can be helpful. If they're highly anxious, they may go to psychiatry or to a social worker, but, massage may be helpful to add as an adjunct. Massage is something that can be integrated. One thing I do want to stress is that massage is not in place of medical treatment. It's not in place of chemotherapy or surgery, or it's to be integrated along with the traditional treatment plan. That's when our patients get the best medicine, right? Is when they have all these resources and they combine them in a way that makes sense and gives them the most benefit. Many of us went into this field because we do see the benefits of massage and it's so helpful. And so, helping them find ways to receive it is something that is something that we're really committed to doing.
Thank you. You are a wealth of information. So, do you have any final comments today about body techniques and their role in cancer care?
I think that massage has come a long way, and now it is in many settings, and there are many skilled practitioners out there, and there are many training programs out there. So it's more accessible than ever. And I think that nurses promoting massage, promoting that their patients like maybe speak to a massage therapist and talk to them about their symptoms would be a really great step. That trust is there in general with nurses. We spend a lot of time with patients and really just trying to encourage them to consider massage as a viable modality that could help improve their quality of life and just day-to-day experience, help them feel more comfortable in their body and help them adapt to the changes that they're experiencing through their diagnosis and treatment and recovery. Just encouraging nurses to share that massage can be very helpful, and as well also for nurses to engage in massage because it's a wonderful way to refresh yourself and really remain available to patients when you tend to yourself and incorporate that as part of your self-care. That makes us much more available to our patients to continue your education about the modality from a personal point of view and a professional point of view, I think that's very helpful. And depending on where you are, trying to find qualified practitioners that patients could possibly go to is very helpful. We can't be everything to our patients. So many of my patients have said, I wish someone would have told me about this sooner. And that's at the end of their treatment. So if you can share this with your patients, I think that's one message I would want to drive home today is please do. And obviously, if we can be of assistance, they can connect with us at MSK, for not only our massage resources, but our many other resources about herbs and acupuncture and mind-body program and fitness, I think would be very appreciated by all of our patients.
Jane, thank you so much for joining us today and for all of the information that you have provided. It has been really great information, and I think it will be very valuable to nurses in helping their patients.
Thank you very much for having me.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you download your podcasts. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org.